Vanakkam, Namaste. I am Dr. Ilango Sethu. I am a consultant liver transplant surgeon at the Royal Care Super Specialty Hospital in Coimbatore. Today, I want you to understand about the acute and chronic liver failures and the liver transplantation, which is advised as a treatment for the same. You see, every patient with liver disease undergoes two kinds of decompensation. One is chronic decompensation, where the liver gradually worsens and fails. This is the normal indication for liver transplantation. But over many years, we have found out that some patients deteriorate very rapidly. They are called acute decompensation. This is now termed as acute-on-chronic liver failure. And acute chronic liver failure usually happens because the patient is taking too much alcohol, or they may have developed a viral infection, or they may have developed infection anywhere in the body which has worsened the liver function. The best way it is defined is by the ACLF, the Asia Pacific criteria, in which a patient's bilirubin goes more than 5 in the presence of brain fogging called hepatic encephalopathy and failure of blood coagulation parameters tested by an INR value of more than 1.5. If you have more than 2 of these criteria, we can consider that your liver disease is acutely decompensated and now has developed acute and chronic liver failure. Acute and chronic liver failure usually indicates that the risk of death is more than 80% at 3 months. This is a very high risk of death. So the presence of acute and chronic liver failure means ACLF is a very dangerous condition. So without treatment, most of the patients die from the condition. So we always suggest that the liver transplant may be the only way out of acute and chronic liver failure. Acute and chronic liver failure usually moves very fast and progresses rapidly. So we also, as the treatment team, we also recommend that the family and the treating team move really fast. Most of these patients are inside the ICU. They may be on the ventilator. There may be supportive medicines for the heart, and sometimes patient may be on dialysis. We usually perform a lot of tests on those patients to see whether the patient can withstand a surgery of like liver transplantation. So after doing these tests, if we find that the severity of organ failure or the number of organ failures is really high, we suggest that the patient may not benefit from liver transplantation. Sometimes we have a score, we calculate them. This is called the ARC score, which is commonly used in India. An ARC score of about 10 or 11 suggests that you are in the perfect window for doing a liver transplantation. At the end, I want you to take a hopeful message. The golden window period for acute and chronic liver failure is 7 to 10 days from the time of diagnosis. So the best option for an acute and chronic liver failure is an emergency live donor liver transplantation. Since acute and chronic liver failure is associated with major organ damage, the surgery for acute and chronic liver failure is also risky. Because the liver in ACLF is very large and the patient also has blood coagulation or abnormalities, we always find that the surgery to remove the old liver is very risky. And once the liver is connected, because of additional organ failures in the heart as well as in the lungs and in the kidneys, the management of these patients takes more specialists than a regular liver transplantation. This patient will continue to be in the liver ICU, may need dialysis, may need increased blood products, and they also have a very high risk of infections, especially if the patient has been using alcohol. So whenever we transplant for ACLF, we always share with the family that the outcome of liver transplantation in acute and chronic liver failure is not the same as a regular transplantation. A regular transplantation has a 95% chance of success, but a liver transplantation for ACLF has around 80 to 85% chance of success. These patients also remain in the ICU and in the hospital for a long time, and they take longer time to return to normal life. They will also need long rehabilitation procedures, more antibiotic and supportive care. But still, at this point of time, I want you to understand that when a patient develops an acute and chronic liver failure, a liver transplantation may be the only best option for survival. Sometimes when we say, based on the assessment of the patient, that the number of organ failure is too high or the risk factors are very high for the patient and the patient may not be suitable, we always recommend comfort care inside the ICU, the chance of death in these patients is almost close to 100%. Sometimes you may not have adequate time to prepare for a liver transplantation within the golden window. In these situations, we use something called a plasmapheresis or a plasma exchange. A plasma exchange is like an exchange transfusion in which we remove the entire fluid part of your blood through a special machine and then exchange it with good quality frozen plasma. So this always exchanges some of the toxins and bad material that is released into your blood from the damaged liver, and this can stabilize the patient. We do a maximum of up to 3 plasmapheresis, beyond which we always try to do transplantation. A plasmapheresis is not a substitute for liver transplantation, but it acts as a bridge towards liver transplantation. So it will buy you a little more time to prepare the donor and the recipient towards the liver transplantation. A plasma exchange also can make the liver transplantation procedure slightly easier because it can control the blood clotting factors. So I want you to understand at the end of the video that if patient has developed ACLF, the risk of death is very high, the risk of transplant is very high. But at the end, I want you to take a hopeful message that liver transplantation can reverse the situation in up to 85% of the patients. So keep the hope, work up for liver transplantation and get the ultimate benefit. Thank you.